So in public health, we work with partners all the time. This is really what, in order to be successful, we have to work with our healthcare partners. We have to work with emergency management. We have to work with the private sector. We have to work with technology solutions and those who are, we have to do that because that is really, at the end of the day, how you prepare for any activity, any game, if you will, is that you have to collaborate. But what I would say is that just like you wouldn't on game day, that you don't want to learn the names of your partners on the day of a disaster, that's what you would do in an emergency, is you want to make sure you're working with partners, you're practicing with partners, you're collaborating with partners, and you're getting to know each other's strengths. And here's the most and weaknesses.
Jeff, you're nodding. How do we get this crowd-sharing ethic before the crisis?
Well, if you're a technologist, I'd say attend your local civic hackathon. You do two things. One is you meet the government officials, like Dr. Shah, that are actually leading teams in times of crisis, and you can hear directly from them what they need and what their experience is in a safe environment. And two is that you meet other technologists that you can collaborate with. And if you're prone to collaboration in the first place, I think it's less about how do you make people more collaborative and more about how do you empower the natural collaborators and let them do their thing. So if you're prone to collaboration, go to your local civic hackathon and meet some folks. And undoubtedly, when the next disaster strikes, y'all are going to kind of raise your hands together and say, what can we do?
Before you can collaborate, you have to have consensus. And I think that's the biggest challenge, is how do you create consensus?
But isn't that chicken and egg, collaboration and consensus? Don't you get consensus through bringing people together?
I think you do, but there is a combination of so to me, it's leadership. It's how do you lead, right? So I think in order to get consensus, you have to build consensus.
What's a model of leadership in crisis, do you think, in terms of natural crisis? Are there particular case studies, either locally or nationally or internationally, of leaders who have responded in ways that have had a very beneficial impact on the community?
Yes. Harvard School of Public Health has actually, with many of the trainings they've done, is called meta leadership, is really working across sectors when you have not just health, but you have health and emergency management, private sector, and you've got all sorts of other sectors that come together, and how do they actually now ensure that across sectors, even if your trigger points and your leverage and your way of getting somebody to agree to something may be different because you're speaking a different language in the health sector, that you're able to lead across sectors. I am so proud of how this community responded, but this community responded because you had a county judge and county leadership and a city mayor and city leadership that worked together, brought people together, and at the end of the day said, we are going to lead our community through this disaster.